there, everyone. My name is Dr. Danielle Nadorff, and I, along with one of my graduate students, Ms. Acacia Lopez, we're going to talk to you today about Kincare, specifically about grandparents raising their grandchildren. And we're also going to talk about substance abuse and its impact on these types of families. So, to give you a brief overview of myself, my background is that I actually got my PhD in West Virginia. I'm from West Virginia. I got my PhD in 2011 in the developmental psychology program at WVU. I'm now an assistant professor at Mississippi State University. And my entire research career is all built around this population of grandparents raising their grandchildren. So we're going to talk to you a little bit more about who that population is and things to do with them in the coming slides. But overall, just know that that's the focus of our lab, the Grand Families Lab, which you can learn more about at www.grandfamilieslab.com if you want to. And we look at how these families compare to foster families when possible. And the broader implications are that I have general interests in both ends of the lifespan, so both with older adults and with children. And I will disclose that I have received an honorarium for this presentation.
Hi, y'all. My name is Acacia Lopez, and I graduated with my bachelor's in psychology from the University of North Texas in 2019. And I'm currently in my first year of the clinical psychology doctoral program at Mississippi State University. I work very closely with Dr. Danielle Nadorff, and I'm a part of her lab in researching grandfamilies. I'm really interested in specifically understanding responses to trauma and their implications on children's development, especially within non-traditional families, and understanding different treatments and interventions that work best for them.
And neither I nor Ms. Lopez have any additional disclosures to report. So, custodial grandparents. What do I mean when I say that? Who are they? Well, by definition, they are grandparents who have primary responsibility in raising their grandchildren. This can take a lot of different forms, though. Typically, they're divided into two categories based on whether the middle generation is there in that home. So if the middle generation is there and they're living all together, then we refer to them as a multi-generational home. And if the parents are absent, then it's a skip generation home. So pop quiz time, and this would work a lot better if there were people in the audience live, but overall, we'll still go with this. You can answer in your head. So as you're going to see here in a few slides, there are over 6 million custodial grandchildren in the US, grandkids living in these grandparent-headed homes. So how many foster kids do you think that there are? Usually when I ask this, I get a wide variety of answers, but almost always people think that there are more foster kids than there are kids being raised by their grandparents, or at least that it's about the same. And that's the most common, and it's usually because of the availability heuristic. So you hear about foster kids, the foster system, people being placed in foster care on the news and articles, you hear about it on TV episodes, so you think like, oh, well, that must be super prevalent. But actually, and this is roughly pretty constant for the past 10 years or so, there's only a little bit over 400,000 foster kids in the US, as opposed to those 6 million custodial grandkids. And even if we're talking about the skip generation households, it's still about like 3 million of those. So overall, the kids being raised in Kincare and by their grandparents far outweigh the number of foster kids. And that also comes into play because for all of its foibles, the foster care system is pretty well defined. They have a good bit of supports in place. They receive financial support, there's scholarships, education available, but as we'll see, a lot of that is not available to the grandparents raising their grandkids and other Kincare systems. So, as I mentioned before, it's pretty darn prevalent. Looking at the grandparent side, there are over 7 million individuals that report that their grandchildren are living with them. About 3 million of them state that they are personally responsible for their grandchildren. So, the differences you see there from those 3 million versus the 6 million before is we're talking about the grandparent side. So, there's most often multiple grandchildren living with those grandparents. As you'll see here, the situation of grandparents caring for their grandchildren involves a wide variety of racial and ethnic backgrounds, but you will notice that, especially within African American and Latinx families, that it's even higher there than you would expect based upon the national prevalence for these individuals. As I mentioned before, over 6 million of the grandkids living with a grandparent householder, and this is especially common in situations where they're being raised by single grandmothers, which that's a lot of confounds against them. That these grandmothers are women, and so we know that women living alone face more challenges, let alone caring for children, and also older women, so they've got a lot of risk factors against them. How about locally? Well, although there are people attending this conference from all across the nation, I know that it's headed within West Virginia. So looking at data from the 2019 American Community Survey census data, over 40,000 grandkids are living in homes that are owned by their grandparents in West Virginia specifically. Although the length of time that they're staying in these homes varies, it's usually a long-term situation with 5 or more years that the grandkids are living there. So we've heard a little bit about the population and who's providing this care, but what's their motivation? Why are they doing it? Well, in 2010, Edwards and Benson developed this theory based upon a large qualitative review of grandparents raising their grandkids, where they called it the 9 Ds. And it's breaking down the reasons for assuming care, and they wanted to kind of be catchy with it and get them all to fit into a reason that started with D. So going through these drugs, which is going to be a primary focus of our presentation here. So in most cases, this is relating back to the parent. So the parent is using drugs or has been in the past. Death if the parent died. Disease if they are sick. Detention, referring to incarceration. Departure. So in this context, departure means that they are leaving, most often like the state or at least that city, to go find opportunities elsewhere. Divorce. Desertion, that's like abandonment in this context. Delivery in this context refers to like teenage pregnancy basically. And deployment refers to military leave. Now, we also, within our lab, conducted a expansion and validation of this theory of the 90s, basically, where we did it with both grandparents who were raising their children, their grandkids, and foster parents raising foster children. And so we found that most all of the responses could fit into this 90s framework, but there were 3 additional factors that we identified as well, and we wanted to make those fit with D's as best we could, so we categorized them as duty, dollars, and daily grind. So basically the 3 additional duty is where they were saying like, well, you know, it's the right thing to do. Dollars, that basically refers to pooling of resources, and daily grind is again with work, but as opposed to the departure, it's more so that they're like just spending too much time where maybe they're having to work multiple jobs, etc. And it's more so that they're too busy working with them than the other answer where it's that they're having to like leave for work. So, what challenges are faced? We'll break that down into challenges by the caregiver and the children. So, the challenges faced are a multitude. On the caregiver side, they're more likely to be living in poverty, and the things that go along with that, including being less educated, less likely to be employed, more likely to have a disability. And something that we hear a lot, especially within support groups and qualitative studies, is that just socially they have this sense of loss based on their roles, this sense of role loss. Before, when they were a typical grandparent instead of a custodial grandparent, you get to have that luxury of sending the kids back home. And everybody laughs about that, where it's like, oh, yeah, I love being with my grandkids, but I love to send them back home. But even though we make a joke of that, that really is a great privilege and a great feeling. It's really nice to be able to take on that role of spoiling them, of getting to do like the fun things and being like, oh, I know that mama won't let you have an extra cookie, but here you go. Just I'll slip that onto your plate, things like that. But when you have to be the mom, you can't have you can't do that. You have to be the one to enforce the roles. So you can't be like the fun spoiler person anymore. And also along with that role loss, you no longer fit in, because if you're talking about like, okay, the parents of your kids' friends, those are all going to be a lot younger than you. And so it's not that you can't be friends with them, but they're going to be going through different lifestyle changes than you. And if you're talking about your same aged friends, they're also going to be going through different lifestyle changes. Like, for example, you probably had planned, oh, when I retire, I'm going to garden, I'm going to travel, I'm going to read more books, I'm going to take up quilting, I'm going to do these things that go along with leisure and free time. But if you're taking care of the grandkids, then retirement is not composed of free time. You're having to go back into all of these small child care duties and doing homework and all those things. So your activity in your life no longer fits with either the people who are in the parenting role but not your age, or the people who are your age but not in the parenting role. On the kids' side, there are also plenty of challenges. Again, the risks of poverty. So they're actually double the likelihood to be in poverty as those that are raised by parents. Socially, there's a lot of risk factors there as well. They're more likely to report feeling grief, fear, embarrassment, and anger, as well as the behavioral problems that go along with those. And they're more likely to have poor self-esteem and socialization issues.
So I'd like to talk a little bit about how substance use specifically affects grand families, both how substance use by a parent can impact the creation of grand families, as well as what substance use within a grand family looks like. So substance use can lead to the assumption of care for grandparents in a lot of different ways. When a parent is using a substance or abusing a substance, it can contribute to child maltreatment in a number of ways. It can lead to the parent's inability to care for their children, whether that's through neglect, death, or incarceration, just to name a few. If a parent is abusing drugs or abusing substances, it's going to lead to an inability to really take care of their children, which is why substance use is often at the root of these kinship placements. When they're not able to take care of their child anymore, the grandparents will often step in and take care of the child. In talking about substance abuse and grand families, I thought it would be important to identify some of the most common substances abused by parents. And then note that when we're talking about substance abuse broadly, it could refer to any of these substances in addition to alcohol. And so some of the most common drugs and substances that are abused by parents are going to be antidepressants, marijuana, benzodiazepines. I put Valium here in parentheses because that one seems to be specifically in the literature often as a common substance that's abused, as well as amphetamines and opioids. And we are in the middle of a national opioid crisis in our country, which has contributed a lot to grand families and Kincare placement. And so understanding that opioids tend to be the drive of a lot of these substance abuse research that's looked at, there are some other substances that are abused by grandparents that contribute to Kincare placement. So children who have lived with someone who abuses substances or uses drugs can suffer from a lot of different emotional and behavioral problems, specifically shame, guilt. They can feel really guilty that maybe they're doing something wrong that's caused their parents to abuse substances or abuse drugs. Same goes for shame. They maybe think that, I am the reason that my parents are doing this. They can feel really lonely if their parents are gone often to abuse substances or are not around very often at the house, and maybe they're an only child. That can be really lonely for a child. It can cause some anxiety, as well as an inappropriate taking on of responsibilities. And so broadly, what that means is if a parent is gone frequently to abuse substances, that's going to leave the child alone to fend for themselves a lot of the times, which is going to cause some of this hypervigilance and detached emotions. So as a young child who is maybe not familiar with how to take care of themselves or fend for themselves, they begin to become on edge to defend themselves and to prioritize their own well-being. And that can also lead to them detaching emotionally from either their parents or their peers, or perhaps both, to make sure that they don't get hurt. Children whose parents abuse substances are over twice as likely to have a documented physical or learning disability. And this can happen for a couple different reasons and present itself differently depending on the child. Children who were exposed to substances in utero really specifically are impacted by this. As you can imagine, substance use in utero has been documented to have a variety of side effects. Fetal alcohol syndrome is one to name. The children can be born addicted to drugs or addicted to substances if the mother is using them frequently throughout pregnancy. And this can cause a lot of problems later on for the children, both as children and then as they develop into adolescence. So what we see frequently is intellectual disabilities and difficulties during critical periods of development. And so children who begin school will kind of start to display some of these problems, both with academic functioning and intellectual functioning. And if there is a proper assessment done, this is where we can typically catch the documented piece of that and actually get a diagnosis for that. But their difficulties can really stem informally from a lot of different things. It can be growth issues, it can be emotional developments are not on track with peers their own age, or they're really falling behind in their schoolwork, which will cause a lot of problems. Children are also more prone to social, emotional, and behavioral problems as a result of their parent abusing drugs. And this can unfortunately lead to delinquent and aggressive behavior. And this is not to say that every child whose parent abuses drugs is going to become a delinquent or is aggressive, but they are more prone to these types of behaviors as a root of their parent abusing drugs and some of those issues that stem from that. Additionally, they're going to have really poor relationship quality, which can lead to attachment disorders. And we kind of talked about this a little bit earlier, where they're going to have that detached emotion because they want to protect themselves. And so that starts off as a coping mechanism and kind of carries on throughout life to lead to these attachment disorders where they're unable to attach properly and securely to their new caregiver or peers or romantic partners even. So this can really have some bad effects on children's relationship well-being overall. And there is an increased risk, unfortunately, for children of parents who abuse substances to develop a substance abuse problem of their own later in life. So they're automatically at risk for that, and that is an unfortunate side effect that we see. So looking more into the substance abuse by children and grandchildren, we used some data from the health behavior in school-aged children and examined the mental health as well as the prevalence of smoking, drinking, and binge drinking in children, and then kind of looked at it by various caregiver groups. So we looked at parent-headed homes, so that's going to be your biologically parent-headed homes, your custodial grandparents, and then the multi-generational homes. And the multi-generational, as a reminder, is when both the grandparent and the parent are living in the home with the child. And so across the board, there wasn't a significant difference for mental health outcomes in children by different caregiver types. But we did find that adolescents raised by grandparents were the most likely to abuse substances. And so this could maybe be theorized that this is due to the fact that their parent abused substances, and that's why they're in the placement with their grandparents and they're in kinship care. And maybe that has led them to their own development of a substance use problem. But that is something that would need to be explored further in research. So something really important for both kinship parents and children specifically is to really understand these 3 C's. And that's cause, control, and cure. And understanding these 3 C's for children can be really empowering in overcoming any shame or guilt or any kind of emotional problems they're suffering from as a result of their parent abusing substances. So reminding children that they did not cause the addiction, they cannot control it, and they cannot cure it. And so this kind of removes any blame that the child may feel for their parent's substance abuse problem. And we did borrow this slide from the Barbara Cates Consulting, so I'd like to just give credit to that. All right, so I'd like to switch a little bit and talk more about the grandparents in the dynamic and how substance use by their own child impacts them, as well as general prevalence of substance abuse in the grandparent population. So in looking at that grandparent population itself, grandparents are at a higher risk of developing psychological distress. And this can stem from a number of things, including health problems, isolation, loneliness, declining mental health, all kind of play into this psychological distress that grandparents feel at an older age. And so 16% of grandparents who raise grandchildren specifically misused at least one prescription drug. And out of those that misused the drug, they had a significantly lower level of well-being than their peers who were also raising grandchildren. And so while this is looking specifically at grandparents raising grandchildren, that is a pretty high percentage to be considered and to kind of recognize that this is a problem that occurs within grandparents as well. So grandparents often become a caregiver during a time of crisis. So if their child is hospitalized due to drug use, unfortunately, perhaps if they pass away due to drug use, or if they're incarcerated, this is going to lead to a really urgent sense of this child needs to be placed with someone. Where can they go? And so grandparents become that caregiver during that really, really time-sensitive moment. And so in that time, there's not a lot of planning going on. They're not able to make a financial plan or even look at what the legal process looks like to care for their child. And so that brings up a lot of issues and stress mostly for the grandparents with raising their grandchildren. So they're automatically at an increased financial pressure. They're raising a child again. They have to provide food, clothing, all of the necessities that come with raising a child. And there's often no legal custody because this is done informally. So this is the grandparents take the grandchild because their child is in the hospital. So without that legal custody, it becomes really difficult to access medical care, to understand how to get insurance for the child, to understand how that process works. Not to mention school. School becomes very difficult when you don't have legal custody. How do you have access to the child's records? How do you navigate some of those issues? So these are just questions that come up during that time of crisis for grandparents that add to the stress that they're already experiencing as a new caregiver. So once they become a full-time caregiver, we've talked about some of the stresses that are associated with raising a grandchild and the legal concerns and financial concerns, but there's also a strain in family dynamics that comes with becoming a full-time caregiver. This is especially true when the grandparent's child, so the parent of the grandchild, is the one abusing drugs. And this causes an immense strain in family dynamics. The grandparents often feel very guilty that they may have in some way created an environment that their child thought it was okay to do drugs, or that they may feel responsible for their child doing drugs. In some way. This is not to say that it's true, but these are common feelings of grandparents whose own children abuse substances and result in kinship placement. And even though all of that is a strain and is stressful, grandparents find it very rewarding to care for their grandchildren, especially during a time of crisis. It makes them feel very empowered that they're able to do something that actually helps and do something that maybe prevents their own grandchildren from an unfortunate situation like their own child is in. But there are increased needs that grandparents have for their grandchildren. They need support with childcare. They can't take care of their children at all times by themselves, especially if they're older and have health or physical concerns. They need support with healthcare for their own grandchildren. It's how do we add a grandchild to a healthcare policy? How do we make sure that healthcare is affordable for the grandchildren if they're not on the grandparents' policy? And they also are going to need assistance with financial aid for counseling, as well as where to find counseling for children. As we've talked about, these children have emotional and behavioral problems that really do need to be addressed by a professional. We also talked about some children have an increased risk for intellectual disabilities. So understanding how to find the appropriate counseling for these children and how to pay for it can often be a point of concern for grandparents that needs to be addressed. But thankfully, grandparents do provide a buffer against early difficult environments, which has been supported throughout research. And grandparents who care for their children typically have their children longer than if the child was placed in foster care. And this is for a number of reasons. There's stronger support connections with a grandparent and a grandchild. That family connection has most likely already been established. And there's not the transition of multiple foster homes or placements, which does have positive outcomes for the child, as evidenced in research.
So far, we've talked about a lot of risk factors. We've talked about a lot of negative consequences of substance abuse. So I don't want to leave you on a bad note, though. I don't want to give you the impression of like, oh, well, if I'm going to take care of my grandchildren, it's all going to be doom and gloom. As I mentioned in the beginning, the bio, within my lab, one of the things we like to do is take a strengths-based perspective. So I'm going to tell you a little bit more about that and why it's not all bad news. So one of the things we like to do is try to get at the question of, is it the chicken or the egg? So there is support from cross-sectional studies there showing that, okay, if you're going to be a custodial grandparent, if you're going to take on this primary responsibility for caring for your grandchildren, that's more commonly associated with poor outcomes. But is it that it's leading to poor outcomes, or is it that there's a third factor that leads to both being likely to become a custodial grandparent and worse outcomes? Those things like the low SES, economic instability, living within poverty, having poor health care, less education, like those things could be driving both of those. So how do we get at that? How do we see if it is the chicken or the egg? That's where it's helpful to have longitudinal studies. So that's one of the things that my lab does, in addition to trying to provide more fair comparison groups, like those comparing foster care to custodial grandchildren. So then there, it's another group where they've been through trauma, which is less likely for children raised by their parents. But if children are not being raised by their parents, there's usually a big reason why. So if you can give them a comparison group like foster children, then it's easier to kind of get an apples to apples comparison.
Within the Grand Families Lab, we try to approach this comprehensive study of custodial grand families through five main aims. Number one, we're overall just trying to find out outcomes for these grand families. We're trying to find out more about both the caregiver side, so the grandparents, and also the grandchildren, because as I've been outlining, they're very, very prevalent and they're very needed because most all of the non-parental care that is provided for kids is done by grandparents. But despite all of that, it's a very understudied area, especially for the child side. So, number one, we're just trying to get out there in the trenches and find out more about what's happening, period. But number two, we're trying to provide these more equitable comparison groups. So, if Johnny and Susie are being raised in a two-parent home, then of course they're likely to have some more pleasant outcomes than than children that are being raised by someone who is not their parent or by only one parent, etc. So we try to do things like comparing them to foster children or other non-parental care, or those raised by in single parent homes or other situations like that. Number three, we try to work from a strengths-based approach. And I'm going to talk a little bit more about that in conjunction with these studies that I'm going to show you on the next few slides. But overall, we're trying to see like, okay, we know that this is not just all bad news. We know that there are definite benefits of having this non-parental care still provided by a family member and still within that family network. So, what are these benefits? What are these strengths? Let's go in specifically looking for that, looking for the good instead of looking for the bad. Number four, we try to translate our findings into interventions. And specifically, I am the director of a local support group for grandparents that are raising their grandchildren. And I'll provide you with some more info on that at the very end of this presentation. But that's one of the avenues through which we can help to provide interventions in groups like mine or like others. And also, we try to advocate from the local level all the way up. I have been involved with Generations United, a national group that does a lot of federal advocacy. Also, the state level, I've met with Senators Ted Cochran, who's now deceased, and Roger Wicker, that are the senators for Mississippi, which is where we're located. But in general, we're trying to just provide a voice, both from the research, but also the clinical standpoint and just the anecdotal evidence that we've heard from these families over the years. All right, so as I mentioned before, there is a benefit, and it's on both sides, the caregiver and the grandchild side. For one thing, we have found that the kids that are raised by these grandparents, they tend to have less frequently reported depressive symptoms than those raised by foster parents. So it may be that these foster parents are providing kind of a buffer against this early traumatic events that have led to the non-parental care. Also, in a study that was using a comparison between foster parents and custodial grandparents and then reporting on child outcomes, and that one was collected through Qualtrics panel survey, we found that parenting practices had significant differences for the two groups, where specifically custodial grandparents were more likely to use positive parenting, which is like warmth, showing a lot of like kindness and positive regard. They also used more consistent discipline tactics, so more likely to behave in like an authoritative manner as opposed to authoritarian or permissive. And also they had higher rates of supervision, so keeping kind of a closer, more consistent watch on the children than the foster parents were reporting. Also, in a different sample, we found that the grandparents um, are reporting that they are experiencing less loneliness over time than their peers. So we know that as we age, with age, we tend to kind of prune our social networks. So we tend to go for quality over quantity and have less social contacts. And for the most part, that's normative and it's healthy, but it can, especially if you're kind of isolated from family and things, it can lead to more loneliness over time. However, these custodial grandparents are experiencing less of that, maybe because they have those children there to, provide companionship and a source of joy and laughter in addition to the stress that they bring. As I mentioned previously, one of the best ways to really get at that chicken or the egg question is to look at longitudinal data. So that's what we did with this study here, which was published in 2020 here in the International Journal of Environmental Research and Public Health. And what we did is we used data from the CBAS, which is the Social Environment and Biomarkers of Aging study, and that's set in Taiwan. And so we looked at custodial and non-custodial grandparents, and we defined those here as those that were living with their grandchildren versus with like the grandchildren present in the home versus no parent or grandchildren present. So custodials versus non-custodials, and we compared them on their self-rated health, 6 health biomarkers, and the presence or absence of 12 diseases, as well as a measure of stress. And so overall, if you're looking at the self-rated health, the custodial grandparents are saying that they have worse health than the non-custodials are reporting. So they feel like they're doing worse. But the interesting thing is, across all of those actual health diagnoses and health biomarkers, the only significant group difference was with respiratory disease. And the direction is actually that the custodial grandparents are reporting less of that respiratory disease than the non custodial. So they were actually doing better. So it's basically what we're seeing here is, for whatever reason, and we're hypothesizing that it's due to the higher burden of care of having to take on the care of that grandchild, and just like with the stress diathesis model, that something's got to give there. So they're feeling as if they're doing a lot worse than their peers, but they actually are not. So the good news is that they are not doing any worse than their peers, and in one area they're even doing better. But the cautionary tale is still that the burden there is leading them to perceive themselves as having lower health. This next project is also approaching the analysis of custodial grand families from a longitudinal perspective. And it has not yet been published. This data that I'm going to present is from a poster presentation. We're working on getting the pub out here soon. But so basically what we were doing here is we were taking data from the Wisconsin longitudinal study, the WLS, and looking at the marital satisfaction for custodial grandparents, both before and after they became custodial grandparents. So it was using two groups of, or two waves rather, of data from the WLS that were 7 years apart. And they were separated on the basis of a question asking, have you ever had a responsibility for caring for a grandchild for 6 months or more? And so it was separated into those who reported that they did have that responsibility, um, not at time one, but by time two. And then the other group reported that they had not had that responsibility at either time. So those who became custodial grandparents versus those who were not custodial grandparents, either way. And we looked at their differences in marital satisfaction based on a modified version of the marital satisfaction questionnaire for older persons. And so that one had, I think it's 11 areas of satisfaction. So it's stuff like uh, the fairness of who does household chores, how often you have disagreements about different things like household tasks, money, spending time together, sexual relations. And then there's also several satisfaction measures. So, like how satisfied you are with your spouse's support and encouragement, with their personality, their amount of consideration for you, how disagreements are settled, how decisions are made, and how well they listen to you. So we did both cross-sectional and longitudinal analyses. And the cross-sectional analyses were looking at just that time two between the custodials and non-custodials. And so with that one-way ANOVA of cross-sectional analysis, unsurprisingly, the custodial grandparents were faring worse. So there were 8 of 11 significant areas in which there were group differences. And with each of those 8 of 11, the custodial grandparents fared worse in the area of marital satisfaction. But the interesting thing is when we were looking at a repeated measures MANOVA, comparing time one and time two and looking for group differences over that, the only area in which there was a significant difference by that time by custodial status effect was in the area of disagreement about how much time they spend together. And it's actually that the custodial grandparents were higher. So, higher in a good way, that the custodial grandparents were less likely than the non custodials to report disagreement about how much time they spent together. So, it's interesting there that just like the that last one I was telling you about with the Taiwanese grandparents, that here again we're seeing that, okay, yeah, if you're looking at just cross-sectional differences, yes, it looks like a message of doom and gloom that they're doing worse. But if you're looking at it over time, that in fact they are not reporting this big decrease as a result of the status, but instead it may again be this kind of question of the chicken and the egg, where maybe stress is from other sources like socioeconomic status pressures or health, because we know that custodial grandparents tend to be vulnerable in both of those areas. This project is currently in press in the Journal of Family Issues, and it's also taking its data from the Wisconsin longitudinal study. So it's using that same paradigm of looking at how we separated and defined custodial grandparents and the selection criteria and everything like that. And also, as I forgot to mention the last time, the Wisconsin longitudinal study is it's basically a study that began back in the 50s using all of the seniors that were graduating from high school during that time, and then following them over time. And then also they picked up some data over the waves with siblings and with spouses, which we're not paying attention to for ours. We're just following the graduates. But one important feature is that they are age matched in here. So everyone is roughly the same age, which is nice. You're not going to have a lot of cohort effects. But okay, so using that same paradigm where it was those last two waves of data and doing the cross-sectional analyses with the very last wave, and then looking at longitudinal analyses over the last two, the focus of this study was on the graduates' cognitive performance. So specifically, the cognitive tests that they use were with word recall, category fluency, letter fluency, cognitive similarities, and digit ordering. And when you're just looking at the cross-sectional analyses with that last time point, the custodial grandparents are doing worse than the non-custodials on basically all of the things, all of the different tests. But again, similar to those Koval-Lance and Nadorff results back with marital status, when we're looking at the interaction of time by custodial status, there is only one area in which there's any significant effects, and that's on this digit ordering scores that you're seeing there on the graph on the right side of the page here. And interestingly enough, it's again in the direction in which custodial grandparents are actually doing better. So it's that they're the green line there, and the non-custodials are the blue line. And so if you look at the first there, you see like, okay, the green line's a lot lower. Their performance, their cognitive performance is doing a lot poorer. But then if you look at how those blue lines slope versus the green line, you'll see, oh, well, the in this 7-year span, the non-custodial grandparents experienced quite a lot of decline. And that is what we see. That's a significant interaction and a significant slope there, a significant difference between time one and time two. The non-custodials are doing significantly worse in their time to cognitive performance score. But the custodials, although they were pretty low to begin with, declined at a much less sharp rate. So they, for whatever reason, and it may very well be related to, running around and getting physical activity with these grandchildren, practicing cognitive skills by like helping them with homework and things like this. Who knows? But for whatever reason, it may be that they are experiencing this protective buffer, but their cognitive performance is not significantly declining. And so that was an exciting finding, and watch for that to come out soon in the Journal of Family Issues. And then the last of our studies that I want to tell you about today that is using this strengths-based perspective is it's in revision right now. It's not yet published, but it was presented at the 2019 version of the Gerontological Society of America meeting. And so what we did is we used data from the census data that is taken every year in the form of the American Community Survey. And they have questions on there that can be used to get at custodial status, because there's both a question about, do you live with your grandchildren, and also one asking if you are responsible for their care. So we separated out non-custodials and custodials by using the definition of custodial as those who both report living with and being responsible for the care of one or more of their grandchildren, and then non-custodials as those who report neither living with nor being responsible for grandchildren. And then we looked at what's basically the disability status for different things, but it's not truly a definition of disability. It's saying like it's assessed as, do you have any difficulties in the area of, and then so it's difficulties with uh, remembering things, getting dressed, hearing, vision, difficulty in going out, and then ambulatory difficulty. So the difference between those last two, ambulatory difficulty is going to be like actually walking around, and then difficulty going out is going to be that more instrumental activity that involves like getting out of your house and traveling into the community, which is more than just walking. So what we did here is we looked at these differences, but we didn't just do a straight comparison of the custodials versus non-custodials. Well, actually, we started off doing that, and we found, unsurprisingly, like, oh yeah, custodials doing much worse. But when we controlled for, within our logistic regressions, age, sex, race, and income to poverty ratio, interestingly enough, we found that in all but one of these, so vision difficulty, all but difficulties with vision, there were significant differences. But after you're controlling for these things that kind of get at that chicken or egg question, after you're controlling for age, sex, race, and income to poverty ratio, the custodials are actually doing better than the non-custodials. Um, so, all of these things have to a little bit be taken with a grain of salt, because you could make the argument, well, maybe they're only taking care of their grandkids because they still can. If they weren't able to get around and do these things, they probably wouldn't be taking care of their grandkids. I've heard that as a criticism before, and my counter to that would be that we know most custodial grandparents from the literature do have at least one disability that they're dealing with while they're taking care of the grandkids. It's not usually just that they are in perfect health while they're doing this. But aside from that, um, although this, along with everything else, warrants further study and further investigation, which we intend to carry out, it again shows that it's a possible buffer, that it's a possible protective factor, that going and doing these things with your grandchildren may help to keep you young, to keep you moving and being able to do those things. So that's another encouraging result.
So we've heard about how there's a lot of challenges and struggles, but also the strengths that are going on. No matter what, though, it's clear that these individuals need support. So where can they turn? What support is available? Well, on a national scale, there's the AARP puts out these grand families guides, and they have a lot of helpful information with state specific listings of different resources. Also, Generations United, that's a nonprofit organization that advocates for these families, Kincare families and multi-generational families, in a number of different ways. Daily Strength is a national support group for custodial grandparents, also specific to the substance abuse side. There is, of course, NAR Anon, a 12-step program for friends and family members of people who have addictions. And at a specific level, a non-local level, but us right here. So I'm the director for the Grand Family Support Group, and it's funded by the Brookdale Foundation's Relatives as Parents program. We meet the second Monday of every month from 10:30 to 11:30 a.m. Central Time via Google Meet. Grandparent caregivers from any state are welcome to join. We get electronic Walmart gift cards as incentives for if you attend 4 meetings, you get a $50 electronic Walmart gift card. And you are definitely encouraged to go to our website, which is grandfamilieslab.com, for more info. And we would love to see you there. If you want to hear any more about the lab or have any more questions for me, I would be happy to speak with you more. And my contact info is up there. It's danielle.nadorff@msstate.edu. And thank you very much. I really appreciate your attention and time. Thanks.